Welcome to Deep in the Heart of Texas. This is Dr. Mario Gutierrez from San Antonio, Texas. Today we're going to talk about some practice management issues associated with Demodex blepharitis, and also we'll talk about delivering the news that the patient has Demodex blepharitis. But first, I've frequently been asked, are things actually bigger in Texas? And the answer is, they are. Last week I had a patient who had a really severe case of blepharitis, Demodex blepharitis, and so I decided to go ahead and mount the blepharitis. It's so big, and you can see here on my wall, you can see the Demodex mite that we have here with all its legs. So yes, deep in the heart of Texas, things are much bigger, and Demodex are huge here in Texas. Practice management. I got an email today from one of our colleagues here in the U.S., and they asked me, is there a CPT code for Demodex treatment? And the answer is, to my knowledge, there is no CPT code for the actual treatment of Demodex blepharitis. So we're left with two choices. We either can treat the patient as a private pay patient, or we can treat them as part of their medical insurance. So we have some colleagues here in the U.S. who are very successful in treating patients from a private pay modality, and they just basically tell the patient, this is the condition that you have, and with that in mind, the treatment program is X to help have you go through the whole program. This makes sense, I believe, in patients who are private pay patients and patients who maybe have an HMO insurance that you're not a participating provider in. The vast majority of us, however, choose to treat our patients under the medical insurance. And so with that in mind, what I typically do when I see a patient who has Demodex blepharitis, I reschedule the patient to come in for treatment, and I typically like to use a day, or I schedule them on a day that is really my slowest day, so it's not going to really slow me down. And so as part of that treatment, I typically will bill an intermediate office visit. And one of the things that we have to keep in mind is that when we bill an intermediate office visit, we have to satisfy the components of the office visit. So we just cannot say, hey, come on in, let me paint your eyelids with whatever special sauce that we decide to put on the patient to treat the blepharitis. So we have to satisfy the various components of the code. So one of the things that I often will do very early in the treatment program, typically at the first visit, I also will bill a 92285, which is the code for external photography. And I like to use my iPhone, and I have an app called, let me get my app here, it's called Pro App, and if I can get to it real quick here. Here we go. Here is a picture of a blepharitis patient, and you can see the mite right there. And it's really cool. You can magnify things and really see the mite in really high magnification like that. It's really pretty cool. So anyway, now the key whenever we're going to build this is a 92285 is not supposed to be used for documentation purposes. It is supposed to be used to help us diagnose, treat, and assess the progress of the patient's condition. So it is not, again, for documentation purposes. 92285, external ophthalmoscopy, is a bilateral code, which means, guess what? You know what? You got to take two pictures. You got to picture the right eye and the left eye to be able to build that code. If you just take a picture of one eye, then you have to use a modifier. Most doctors will use a -52 modifier to build that, but it makes no sense to me why you wouldn't want to build it completely and take a picture of both eyes. So now let's talk about cost of goods. There are some cost of goods involved to treat a blepharitis patient. There are some commercially available kits that, for example, we'll use they have some secret Demodex killer sauce and a paintbrush to be able to paint them on and kill the nice little mites. And typically, most of us will have the patient pay for the kit. Again, most insurance companies will not pay for this, and so subsequently the patient ends up paying for this. There are many of us who also have decided to uh, recommend at-home treatments, and so we will often stock at-home treatments here in the office, and these are a couple of the products that we typically will stock. And this is fantastic for the patient because it's really convenient. They don't have to go anywhere else to get it. We can typically get it at a really good price for the patient, and it's a nice little profit center for our practices. And so it's really good, really convenient, and again, it helps with compliance because we get into them right here in the office. And again, it's a nice little profit center for the practice. In addition, I feel if you're gonna treat Demodex blepharitis, you need a microscope, and the microscope you want to get is one that has a viewing screen so that you can then also show the patient the mites. And we'll talk about that a little more in a few minutes. The cost of a microscope is about anywhere from $200 to $300, something along there. Those are typically adequate. And if you are interested in what I use, email me. My email address is mariogut@flash.net, mariogut@flash.net. Email me, and I'll send you what I use, and I've had it for 3-4 years. It works absolutely fantastically and inexpensive, or relatively inexpensive. So now it comes time to deliver the news. Your patient has blepharitis, Demodex blepharitis. You confirmed it. You've seen it either via the slit lamp or you see it via the microscope. So it's time to deliver the news. And again, we have two choices. One choice is you describe it generically. Gretchen, you have Demodex blepharitis. I'm so sorry. So you can describe it as just generic inflammation of the eyelid, and you can go that way. I frankly prefer to be honest, upfront, and say, ma'am, you have Demodex blepharitis. It's an infestation, and here's where I beat a dead horse. I say it's common. Most of us have blepharitis. They're just having a tailgate party in your eyelids right now, and we gotta limit the numbers. It's a numbers game. So, as I tell patients this, I remind them it's common. Again, I'm beating the dead horse. It's common. It's common. Even pampered movie stars have Demodex. Everybody has Demodex. Bottom line, that's what I'm talking about. So now the next step is, how do you want to show and tell? I like to show and tell, so I ask the patient to come in. I show them the microscope with the viewer, and once I do that, I feel that the patient tends to be really compliant because they see these little things moving around in the microscope. They're really kind of cool to see moving around. And I'm going to ask you guys to be prepared for two things when you show patients mites. Be prepared for the look, and be prepared for questions. And the look is this. I have what? That's the look. And be prepared for a bunch of questions. How did I get it? Blah, 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 blah. I know my colleagues will be discussing this in more detail. I offer the patients some websites to go and visit because you know damn well they're going to be Googling that thing since they have these things crawling inside and eating their eyelids and eyelashes. And so give them some sites to visit. In closing, killing mites is fun. It is a lot of fun. You know, it reminds me as a kid when I would use a magnifier to burn ants. And you know, I've recently been having some fun with my son burning ants with a 20 diopter lens. It really works absolutely fantastically. So killing mites is just a lot of fun. And I'm trying to see if I can get my computer going here. You know, you all remember, now this is a guy thing, so I'm sorry, I'm gonna talk about some of the stuff that us guys think about. Do you remember the Apocalypse Now, that movie where the helicopters are flying over the water and they're fixing to attack the village, and Robert Duvall has his soldiers play some music? Remember this song? It's called the Ride of the Valkyries. Let me see if I can get this going here. I'm telling you, that puts me, man, in a mite-killing mood right there, listening to that kind of music. But seriously, guys, here's how I feel. I am really proud of Optometry taking the lead here in Demodex blepharitis. I can tell you that I've been treating Demodex blepharitis for many, many years. This is fantastic for the patient. This is secondarily great for the practice. And it's indeed really, really rewarding, because I can't tell you the number of patients that have come up to me over the years who have been misdiagnosed and treated insufficiently. And once they're treated, I can't tell you how happy your patients are going to feel, and how um, how honored they're going to feel, and how honored you're going to be that you were able to take care of them, and where nobody else had been able to. So again, thank you for spending time with me today. And remember, if you are wanting to find a trophy mite, come to Texas. Thank you, and happy hunting.